provide an outreach and an opportunity, honestly, to be together tonight with all of you from across the country, knowing many of you, some of you have had yourselves come home from overseas suddenly. Some of you, your children or your athletes came home suddenly from overseas, or just all of us who are looking ahead to the summer and seeing a lot of uncertainty. We know there's going to be a lot of uncertainty still at the end of this call tonight, and there will be uncertainty in the weeks ahead. But we wanted an opportunity to share where we are and provide what we know at this time, and provide some overview and updates from some of our partners and our some support that we're going to be providing and able to provide. There will be an opportunity for everyone for questions. Ce soir, à la fin de cette présentation, on fait beaucoup de temps pour des questions. The questions, you can pose questions in the chat box. It's in the corner of the web interface, or you can email jcartwright@canoekayak.ca. So jcartwright@canoekayak.ca. JCARTWRIGHT@canoekayak.ca to ask some questions at the end of the conference, at the end of our webinar. We're going to go through with our updates and then turn to the questions. There may be questions we don't get to, and we apologize for that ahead of time, but we will follow up, and we will be providing with each of our presenters opportunities for where we can get more support. I will say off the top that we already have scheduled a finance and employment insurance and details for employers in our system. That's a big area that I know is a big struggle, and for budgetary planning and contingency planning as we look ahead. We have already scheduled a webinar for next Wednesday, April 1st at 8 p.m. So just know that we will continue to be following up in that area with everyone. Ce soir, qui vous a des questions en français, on répondu dans les deux langues officielles. I will always do my best. Avec moi ce soir, c'est Madeleine Hall et Pierre-Luc Laliberté qui aident-nous pour expliquer quelque chose en français et répondre des questions en français que ça c'est ton langue de préférence. Aussi, on fait de traduction de toutes les submissions qui ont ne répondu pas ce soir sur cet webinaire. On répondu sur un document avec traduction. So thanks everyone for joining the call. We're going to go through our agenda tonight, and just finally from me, just thank you for all the support and for looking out for each other. So far, it's been really difficult time, but certainly, as always, our Canoe Kayak community has pulled together and supported each other. And personally, as I've been in touch with many of you who've been traveling back to Canada, and it's great to know that that we're all, from what I've accounted for, all those who are now back home, are home, and those that are in quarantine are in quarantine, and that now we can move to our next stage. So I'm going to pass things over now. I'll just reiterate once before I start. There is the chat window in the webinar platform, and you'll be able to pose questions there. We'll scroll back through the questions at the end, and also you can email jcartwright@canoekayak.ca, and when it's time for questions, we will redo that information. I'm going to pass things now over to our president, Chris Hellier, who's going to make a few remarks. Chris.
Great, thanks, Ian. Again, thank you to everybody for joining the call tonight. We realize that we're all facing great disruption in our lives. It's not just impacting our paddling, but it's impacting, just the way that we live. And we thought, from the perspective of our shared passion for paddling, it would be good to have a conversation about how COVID-19 is impacting our community and what we can do to keep everyone safe. As Ian said, there's been a lot happening at the international, national, and provincial level, And all of the CKC staff have been very active in these discussions and can share some of what they've learned with us tonight. In addition to protecting the health of our athletes, coaches, staff, and volunteers, which has to be our priority, we need to think or try to make sure that we can ensure that our member associations, divisions, clubs can stay healthy and ready to resume activities once the pandemic has passed. One of the things that we've been thinking about a lot is that there is going to be time when this is over. And issues such as, trying to keep coaches involved in the system, addressing revenue loss, due to reductions in membership, potential loss of summer kids programs, and the impact of lack of competitions for an organization such as ourselves, whose mission is specifically to support competitive paddling. We know we're not going to have all the answers tonight, and we know that this can feel frustrating. But what we want to promise to you is that we'll share information and decisions as soon as we can, and that you should always feel free to reach out to the staff and the board members if you've got any concerns or ideas about how we can keep the sport safe and strong and ready to get back to it again. So again, thank you for joining, and I'll turn the mic back to Ian. Ian?
Thank you, Chris, and thank you now all 161 of you. I'm very happy that so many of us are here this evening. I'm going to pass things now to our Chief Executive Officer, Casey Wade. Just make sure Casey can get on, off mute.
Can you hear me now?
We can, yeah. Good.
Okay. Okay, well, thanks, Chris and Ian for those comments. And I too want to welcome everyone here today. Thank you for taking the time to join us this evening as really one Canoe Kayak Canada family. It's been, goes without saying, it's been a very, very unique and exceptional time for all of us. The last 3 weeks have been extremely busy, particularly the last 2 weeks. And we're living through, and this, looking through the media and all the updates, one of the worst, probably the worst medical pandemic we've ever experienced. When we've gone through this, and we'll get more into it, we've always looked at the health of the individual, family, community, our country, and of course the global state, as we're in a heightened state of risk. And unfortunately, it's going to get worse before it does get better, based on medical evidence. So all our decisions were made as we were moving forward in an attempt to keep us safe, respond to the ever-changing landscape, and maintain a focus on our paddling community and impact on all of us and you. We've also been working very closely and actively and on a regular basis with Canadian Olympic Committee, with On the Podium, with Sport Canada, with our national sport governing partners, and with the International Canoe Federation. For tonight, it's important, and Chris mentioned this, to keep certain things in mind for our discussions. We have to keep our discussions firmly planted in the reality of this COVID-19 pandemic. We have a lot of things that influence our decisions around government guidelines and recommendations, medical advice, certainly things happening at the international sport level, and we'll talk a bit about the COC and IOC decisions more recently. And they impact the decisions and guidance that we provide and we collectively provide. And they happen hourly, daily and weekly. So it's not, at times we simply need to keep things at a macro level. This means that this means that we have to keep it in a unique and challenging and ever-changing environment. But the macro level is one where we may not be in a position today to solve things, and we have to act on what we know versus what we don't know. It's incredibly important that we all understand the challenges and our needs, and that we work together to help solve them, or at least navigate through them. The new normal for 2020, we don't know what that's going to look like. things are changing. We can say one thing, it's going to be different than we've ever experienced, and we're trying to find out what that'll look like based on the pandemic we're living with, the unknown of what's going to happen, and changing decisions like the International Olympic Committee and the suspension of the games. So we need to collectively be leaders in this, and we have to stay calm, be patient, and work together. We also had at the outset, a CKC COVID-19 emergency working group. It's a bit of a mouthful, but it helped us guide us through our decision making, sometimes at the very last minute with little notice. And this group was representative of our lead staff, disciplines, athletes, high performance, legal, and of course medical. And I think Adam Clevenis is on the call tonight, and Don McKenzie, if he's not on, he's joining us, and he may be a few minutes late because he too is trying to scramble to get the supplies at the hospitals in BC. So I want to thank everyone that was on that committee to help us guide these decisions. So that's really, I guess, to set the context and the tone for this evening. We have to work within what's known. Things are changing, and we all have to be patient and be leaders collectively. It's not easy. We know there's a big impact on all of us. The agenda tonight, the way we set it up, is really one of trying to give a high-level picture and focus in on the things that are impacting you, in your communities, in the divisions, in the clubs. We know full well at least what's happening, and we need to work together to come up with some solutions. So I'll pass it back to you with those comments, Ian.
Thanks, Casey. And we've got some comments. We'll try to use the video functions for those that can use them. So thanks for the feedback. Not everyone has them, or not everyone maybe had cleaned up their living room or whatever. So just the next brief item, I wanted to direct everyone to know that we have set up on our webpage a COVID-19 update webpage. I hope some of you have already been directed to there. That is kind of our central hub for providing updates to our community. We started out with a process of providing kind of every 2-3 days a written update, but we've quickly found that information has been coming so quickly at us, and it's hard to keep up. So the best route for us is to have that evergreen page where all our members can go to find that information. The key messages on that webpage are there, and I think most of them actually we're going to review when we talk about CKC's current recommendations. But the key message from us at this time overall, we'll let Don speak to that in detail, is that of caution, safety, and health for all members of our community, and for all of us within CKC to do our part to be leaders in what is a struggle for the world and a struggle for us in Canada. And that's us to make sure we're doing what we do as a Canukai Canada community well, and that's being leaders. So I just wanted to direct everyone to that webpage. It was linked off our agenda tonight. So on maintenant à page de site de web pour COVID-19 sur en page de web. That's where all our updates will be. So now we'd like to have an update from Dr. Don. I'm gonna just let staff here send me a note if we've heard from him. So Don is calling in. So what we're gonna do is I'm gonna ask, if you're a caller right now on the line and you're not our chief medical officer, could you mute your line, please? So look on your phone if you could mute your line. And because we're gonna, hey, Doc's here. Thank you. So if everyone else could please mute, and then Dr. Don's gonna speak. Thanks, Don.
I'm okay. Good.
Yeah, you're great.
Okay, let me, if I can, this is speaking from the pure medical side of this thing. This is unprecedented, of course, and whereas it's an exciting time to be a doctor, it's not the place you really want to be. But let me start our discussion very briefly by reading something that I obtained today from the chairperson of the ICF Athletes Committee. And some of you may know him, Tim Lodge. He's the representative of the athletes with the ICF, and he's got a few things, and I'm just going to take a few points from it. But the first thing that he obviously was talking about was the press release from the IOC and IPC that the games have been postponed. And as a committee, the group of athletes, they were quite pleased with that decision. And as he says, we hope that this will now give you all the comfort you need to focus on looking after yourself and your families, to stay at home and do what you can to assist everybody involved in containing this virus. And he points out this is now beyond sport, and we must consider our health and well-being as being paramount. Again, he says, I know there will be questions about events for all disciplines for the rest of the year and the qualification for games for next year. I ask that you not try to discuss or speak speculative opinions, and be confident the IOC, IPC, and the ICF will make sure that the future is fair and safe for all of the athletes across the world. We will keep you updated, this is the Athletes Commission, on any progress as soon as we have it. In the meantime, we feel that your welfare is our primary focus. As a committee, we will be sending out a survey shortly on welfare, and we will also start to post some content on our Facebook page and the ICF website, the things that we feel may help you all while you are continuing confined to your home. Your mental health is key at this time. We want you to help you with anything we can. Stay safe, take care, keep your distance, stay at home. So that's from the chair of the Athletes Commission, the ICF. And actually the medical side of this right now, the ball really is across our entire country is in the hands of the public health officers. And I'm sure you've been inundated with self-isolation and social distancing and all of the things that we as individuals have to do to make this work. And I can't emphasize enough how that is true. That's where the ball really sits. So it's up to us to be pretty anal about not bending the rules. So, you know, if you're confined to self-isolation, as those of you who have returned from the U.S. or elsewhere still are, then you know what the rules are, and you have to obey them. So it's really absolutely critical that we do this. On the other hand, one of the things that we still can do as practitioners and athletes is that you can still get out and exercise a little bit. And the secret there is that you're doing it by yourself or you're doing it with the people that you live with. But exercise, I think, and as maybe Tom will say, in the mental health side of thing, is going to be instrumental or very helpful with us in dealing with this process of getting past this virus. Now, a lot of people will be looking for, well, when is this going to happen? Like, what is happening here? And nobody knows that. I mean, you look at the epidemiological data from China, and it's taken them at least 3 months to get to the point where they're starting to relax some of their tactics to deal with this problem. And yet today we saw that they're limiting foreigners traveling into the country to prevent a rebound effect of this virus. So Canada was maybe a little bit delayed, and we're certainly not quite as draconian in our measures. We seem to be having some success in terms of managing the number of cases and deaths. This is, far from good news, but it's better than some other countries. I don't think we're on the same trajectory as Italy and Spain, perhaps. I think we're much better off in terms of the way we're managing this disease, but there's still no crystal ball that is going to tell us when it's time to relax our efforts on containment and mitigation. So, I mean, we wait until the public health officer will tell you. I mean, the activity in sport is basically in their hands. They're going to say when the community centers can open, when the gyms can open, when the clubs can reopen, and we can all get towards normal. Frankly, I think it's going to be quite a few months, and I think that CKC is going to have to make some difficult decisions ahead when it comes time to trials and other competitions. The ICF, as you know, has canceled all of their international competitions until the end of May, and then they're looking at each one on an individual basis. It wouldn't be surprised to me if a lot of those events are canceled throughout most of the summer, maybe even into the fall. As a medical person, I think that for some of us, we're going to need a vaccine to kind of put this entire crisis behind us. And vaccines take months and sometimes years to create, but that's well into the fall and probably into the early next year before there'll be a suitable vaccine that will do for us what the flu vaccine does. So it's a difficult time. I think all we can do is obey the things that we have control over, just like training. So, you know, exercise is important, but so is social isolation and social distancing, and just doing what we can for the people that you love. And it's an extraordinarily difficult time. It's going to get a little worse, I think, in Canada. It's going to get a lot worse in the United States. I tend to be one that says, don't spend a whole lot of time watching, you know, television about this, because it doesn't do your mental health any good. Pick some information that will give you some updates from time to time, and maybe CKC is the place for that. But you know, don't dwell on the virus. Obey what the rules are, but also realize that there's other important things in your life as well. So I'll stop there, Ian.
Thanks, Don. And Don, to be clear, you're able to stay on the line for questions a little later on.
I'll stay on as long as I can. I'm kind of trying to source some equipment for our clinic, which is closing because we ran out of masks and important things that we need. But I'll be here for as long as I can. Okay.
So I just want to make sure people do have an opportunity to ask you questions. So we'll try. If Don, maybe if there's a pause and you have a 10-minute warning or something, can you give me a heads up, just so we really value having you on the line to answer some questions.
Sure.
And I think that I think also that I'll speak for you, Don, that if people do have questions, we can find a way to get them to you so you can answer from our membership.
Sure, happy to.
Okay, so thanks, Doc. And it's great to hear from you. Our next section it follows up on that to talk about our CKC's current, I'm going to turn my video on, our current recommendations at this time. And we're going to walk through these right now at a relatively high level and give a snapshot of where we currently are with our recommendations to our membership. I'm gonna ask Graham will join me and perhaps James as well, to provide any sort of specifics that need to be filled in. We have been meeting in the last couple of days with our board of directors, with our Sprint Racing Council, and our other committees and councils will be meeting in the days ahead to continue to discuss these recommendations. Our current recommendations at this time broadly are still the recommendations that you've seen on our COVID-19 webpage. We do not have a major update on our current recommendations at this time, but I do want to walk through them. And our French language recommendations on that site are on the page at this time. I think it's important for me to start following up with our discussions with Don and with our discussions with the Canadian Olympic Committee, with the Government of Canada through Sport Canada and the other departments. That these recommendations are based on a continual amount of consultation with our partners. And there's the quick question. We will be following up with written, with sort of an email roundup. So we'll make sure we do that for everyone. The big high level for us right now is that as an organization, we're asking all our members to respect the Government of Canada's direction to carefully follow social distancing protocols. That's us needing to do our part. We also call on everyone to listen to the health authorities in their municipality, in your region, in your province. A challenge for a national organization at this time is truly it's a patchwork, and things, as Don said, will evolve as we go along. And our recommendation to everyone as individuals is to stay diligent, to see yourself as a leader, to work to be part of us solving this crisis together. And we know we're all in the same boat on this. In terms of our specific recommendations, these are the recommendations that came out of our work with our task force we'd set up as an initial response to the crisis, and we've had initial discussion with the board. As I said, we'll be following up with more formal communication to make sure everyone through our webpage and with these recommendations. But our recommendation in terms of our recommendations to our clubs and organizations, which is clearly, and I want to be clear, is the recommendation that we as CKC can make. our members are our paddling organizations. So our clubs in sprint, our PTSOs, and in our other disciplines, and our members within our organization. There are other members, other PTSOs within sprint. Our members are who we make recommendations to, and our recommendation is that those organizations suspend their in-person activities. This is in line with the recommendations across the countries from municipalities. It reflects all the rec centers and pools across the country that are shut down. Places where people congregate are places where we do not need to be at this time. We know this recommendation is difficult, and we're going to talk about the implications and how we're working with you to deal with the fact that shutting down the heart and soul of our sport across the country is so difficult. Again, we want to reiterate that it's very critical that those that have returned from outside of Canada follow the mandated 14-day protocols for isolation. And if you have questions about that, Don's here. There's great resources we've linked to online. I'm going to let Graham in a moment speak over an overview about our position with our events, and I'll fill in. But I just want to speak about the follow-up and next steps for now with our recommendations to our organizations. And be clear that, because it's a natural question, what's CKC's recommendation to individuals, not organizations at this time? Our recommendation is the first part. We want everyone to be safe. We want everyone to follow what they're being recommended by public health. Public health are the people leading the way right now, and we need to listen to them. As Don mentioned, exercise, activity is important for mental health, but we need to put everything very much first and foremost through the filter of our health of our communities, our health of ourselves, and be leaders. We are working with our partners constantly right now in terms of our members. We're listening to feedback from coaches and clubs. And as Don mentioned, this is not something we're anticipating that's going to be short. And that's the grim reality, that we may have months and months to look at this problem, to deal with it with our members. And we're going to be working together to try to find ways we can recommend activity that's safe, activity that follows social distancing protocols, but also critically meets with our on-water safety protocols. I would expect that you would hear from the different discipline councils, and for just quickly the uninitiated, we have 3 discipline councils in Kayak Canada: Sprint, Whitewater, and Marathon. And I would expect that you'll hear more detailed recommendations, more support, and we're going to get feedback from those councils as we shape those recommendations as we adjust to the new normal. So that's our position at this time with our member organizations, to suspend activity, to suspend on-water activity through the organizations, and that we follow the directives to stay home and stay safe. I'm going to pass it over to Graham to talk at a high level and I'll help you, Graham, to talk about our recommendations for events.
Hi there, everybody. Yes, it has been a difficult time. Much to Dr. Don's recommendations. I feel like to for what seems like an eternity. It's amazing to think that it was only a little over a week and a half ago things seemed normal for our group, particularly for the sprint team that was in Florida training for the Olympics. I think there's been some pressure relieved from what transpired in those 10 to 14 days with the cancellation of the postponement of the games to 2021. The message I've been sending to the athletes at this point in time is to treat this as you would as a post-Worlds period, where you're trying to recover, and the additional information from the local health authorities to stay home and engage in active rest as we figure out what else is next. That's easy to say for athletes that are preparing for the Olympic Games at this point in time. It's a little more difficult for the younger athletes that were preparing for other competitions that are happening this year. All I can say at this point in time is we don't have any additional information. Things are looking as if we might be in a situation where there's going to be limited competition this year, just the sheer reality of travel, health concerns, etc. But as soon as we know, we'll let you know. There's we set a deadline of April 15th by which we would let you know what would be happening with regards to the sprint team trials, as well as any international competitions that are still scheduled at this time. If we don't know at that point in time, then we as an organization will make a decision based on all the medical and available information that there is out there with regards to all the different moving parts. In terms of our messages to the team, we've kept the team informed as much as we can, daily, hourly, when things come out. We got some really positive news from the COC in that we were able to reach the team before the announcement actually came out about the postponement of the games, with respect to the Canadian Olympic Committee and the Canadian Paralympic Committee withdrawing from going to a games this summer. And that we also have been trying to guide them in terms of what they should and shouldn't be doing as we move forward. Certainly one of the concerns we have, and we understand the motivation that athletes have to train on a regular basis to keep their fitness high and to be motivated to continue. It's a difficult time to do that, but we also want to make sure that our athletes are safe and that they don't engage in unsafe practices on the water. Even if it is an individual exercise opportunity, that we also are in a situation right now in Canada where the water conditions are not safe. So there are additional risks and requirements of that. I've kept the athletes informed on this, and James has done the same. I'll let James speak to any specific differences with respect to slalom in a minute. And I just really think it's important to recognize, as Ian has said, that this has evolved daily, hourly, and that basically trying to keep people to understand that there are things that we know, things that we don't know, and things that we should do for now, and that those will change as probably tomorrow. And so it's a matter of making sure that we're safe with our families, that we stay active, as Dr. Don said. I've been rowing on my rowing machine daily just to try and do that. And I've been sitting on my porch to try and get some sunshine and some vitamin D. So that's it from my end. Stay safe, everybody.
James, did you want to add some updates, and then I can speak to a few more specifics?
Yes, can you guys hear me now?
Yes.
I think I'm on mute. Okay, perfect. Thank you, Ian. I'm just going to try to share my screen as well. See if I can turn my camera on.
We can see you.
You can see me? Perfect. Okay, I can't see myself. So yeah, on the slalom side, what I can say is that, well, I think Graham captured all the essentials, and those do translate over to the slalom side. We're obviously in a period of pause, and we're back to a planning stage, but the challenge is we don't have all the answers, and we don't know what we're planning for yet, at least for the international season this year. I do have confidence that the international race organizers and the ICF also has the health of the participants, of the athletes and the coaches and officials as their top priority. And I expect that we'll get some more information from them for the international schedule for this year. And we'll also be updating the slalom community by the middle of April with respect to team trials, what our plans will be for this competitive season, and what our plans will be moving forward for selection for the 2020 or 2021 games now in Tokyo. We are in a different situation a little bit, where we have selected 3 athletes already that are on the Olympic team, so they're now in a wait-in period, but we're hoping to qualify another quota for the women's C1 spot as well. And that's obviously in pause because of the cancellation or postponement of the continental selection races. So I think it's just important, Don captured the essence and Graham did as well. We're in a period of pause right now, and we need to find some answers, and we'll certainly get back to you and share those answers as quickly as possible once we have the information on a competitive season.
Okay, great. Thanks, James. I wanted to add a few specifics. We did have a meeting of the Sprint Racing Council yesterday, and we did discuss at the council firming up some of our contingency planning, and we identified specifically for the sprint national championships, the key considerations we're going to have to think about and the timelines in which we will have to make what could be a difficult decision. At this time, our plan with the organizing committee of Rio 2020 is proceeding with the planning for that championship, which is at the very end of August. We are hoping that we will be able to have the championship, but we are also keeping an eye on the factors, and the factors for discussion of that event include first of all, obviously a return to a state where the health of all participants can be ensured. I'm describing the lens we're using for all the domestic events. Will air travel return to a state that's normal and affordable to a level that makes access to an event possible? Is there enough lead time and enough ability across the country for athletes to train in at least a uniform enough manner that it's fair for the athletes coming to compete together? Also just purely the status of the venue in Ottawa and the regulations involved with what's happening in this jurisdiction here where the championships will be. That's not just specific to this event, but I know it's important. We know and acknowledge that event has only been canceled 7 times for the World Wars in the history of the event. And certainly none of us take that discussion and any of these decisions lightly. We have, as staff, and we're going back to the SRC to circle June 1st right now as our date on which we expect to be able to make a final decision on the national championships. It's very difficult, I'm sure everyone can appreciate, to pick a date now to where we can make a decision for something with so many unknowns. But through that discussion, we will be trying to firm that up and follow it with official communication. But our tentative date, we're circling for that process for those championships is June 1st. I know that I've spoken with my colleagues from the Marathon Council, and we're working together at the board level on horizons for uniform cancellations if they make sense across our system. We'll follow up with those in the days and weeks to come, and the Marathon Championships coming up in June in just outside of Regina on the beautiful Qu'Appelle River. We know that that's going to be a challenge, and we'll be working and communicating with everyone around that event. I will be able to answer questions at the end, and we will be following up, as I said, specifically with our disciplines for the specific nuances of the domestic racing seasons and the considerations we're making, for example, for the different trials. I'm going to turn the mic over to Tom Hall in a moment, but I think now, perhaps respecting Dr. Don's time, if people start having questions specific for Dr. Don, you can use the chat window, or you can email James Cartwright, jcartwright@canoekayak.ca with questions for Dr. Don. I'm going to let Tom make his presentation, and then we'll pause and perhaps sort of that lens of medical and mental health expertise. We can answer those questions after Tom has spoken. And then keeping an eye on the time, we will move along to the critical club impact and economic impacts. And I am thinking of those in Nova Scotia and the Maritimes tonight where it's getting later. So I'll pass it over to Tom, Tom Hall.
Hey guys, hi everyone. Can you hear me? Yes?
Mm-hmm.
Cool. I can turn my camera on and you can see, like many of you, I've shifted to home. I can't turn it on, so I won't. Yeah, so quickly, so just to be clear, I'm not a psychologist or anything like that. This is part of my job. For those who don't know, I run the Canadian Olympic Committee's program called Game Plan, which is athlete wellness program, and it's really a collaboration of the Olympic Committee, Paralympic Committee, and the federal government, and we help athletes with virtually everything but the specifics of their sport. So everything from their mental health to education to career planning and all the rest, and mental health is a big part of that. We about 2 weeks ago, it became clear that this was going to be an absolutely massive deal, and it has risen to that occasion. And so I think very quickly at a club level, if I give you a sense of what we've done at the Olympic, Paralympic level, and then a few key takeaways, that might help, because there are some real concerns about athletes. And I think there's a few groups of athletes at the Olympic, Paralympic level. There are those athletes that have just lost their games, right? And so they don't know what's next. It's like they've suffered a catastrophic injury of some kind. And so we're trying to help them pivot into whatever their new normal is going to be. And then there are those athletes that have simply lost a year, but are able and ready and willing to focus on next year. The thing is, for all of those two groups and everyone in between, like Dr. Don said, and everyone else has said, we have no idea when this is going to end. There are some, very credible articles that say this could go on for months and months and months, if not a full year of on and off social distancing, until there is some sort of vaccine. And so our concerns for the Olympic level, Paralympic level athletes have been, one, frankly, ensuring that they're following the rules, which is why the COC and CPC pulled the trigger on the games early, was that there was no safe way an athlete could train now, and no way that we could ask athletes to go out and prepare for games that started in this summer. That made any sense if we are, a part of Canada that values the health and safety of all Canadians. So that was why the Olympic Committee and Paralympic Committee came out early with that decision to ask athletes to stop training. And the messaging, frankly, is if Olympians and Paralympians don't need to train now, why do you? And that is their call to action for any Canadian that values physical activity. Of course, the other side to that is the mental health side of it. Going from a life of activity, particularly a sport like canoe kayak, where we spend all our time outside, to social isolation or whatever you want to call it, where we're locked inside, can be extremely destabilizing and difficult. And so there's a few ways that we're trying to address it. One of the key ways, frankly, is to build virtual communities of support. And you can do this at a club, and I'm sure it's already been done at many, but find ways to interact, whether it's through Skype or another social media activity. Do it safely. Make sure that if you're working with minors, there are parents involved, and multiple adults on the line. But get the athletes together and regularly, and make them feel like they're part of something. And it might not be so bad now with school, but I am totally anticipating we're in a very similar situation once school is out. And so that's our big concern with athletes. We know those who are in school are doing better than those who aren't in school because they have something else to focus on. But it's a major deal and a major concern. So those online communities of support where you're getting together and training at home and doing a circuit in your basement, that stuff's great. Another important thing, and we're working on actually publishing materials that you'd have access to, is what the detraining looks like. So again, for the Olympians and stuff, the physiologists and our doctors are like, well, it's not the end of the world if they take some real time off. Many athletes overtrain, and so they might actually be forced to undergo a minimal amount of training for a significant amount of time that might actually be good for them. But the trick is how much, and then how to detrain effectively. So you're not destabilizing yourself. As you know, if you just cut cold turkey, your body gets all out of whack hormonally and chemically, neurochemically, whatever it is, and that can also be really destabilizing for an athlete. So ensuring that they're doing something, but they're doing it in a safe way where they're not at risking themselves or anyone else, is absolutely crucial. And the recommendation is really, if you can do it inside, a treadmill is ideal. If you run outside, make sure you're nowhere near anyone else. Those are some key things. And then the third thing, and I'm on a work group with most of the lead mental performance people in Canada, and a couple of the recommendations that have come out are really to try to take advantage of this situation. As things continue down this road and it gets, I think, most athletes are pretty positive about it now, and they're kind of grin and bear it, or they're doing okay. I say most, that's probably an exaggeration. Again, in 3 weeks, I think it'll be very different. And I think it's an opportunity to focus on the stuff that maybe we and I put myself in this bucket as an athlete, didn't focus on enough, and that's probably the mental training side, right? So taking advantage of this time to study resilience. There's some great books out there about maintaining a positive attitude, maintaining grit through times of adversity, and then how you can apply that in a constructive way to your situation. So again, if I'm a coach or running a club, that would be something that I would encourage my athletes to embrace. And then the real need to have a bit of empathy for your athletes and to make them understand that this is truly, you know, a global crisis, frankly, and that it is okay to not be training. And because one experience that has come up a whole bunch at the Olympic, Paralympic level is this great feeling of guilt. For the first time in God knows how many years, these athletes are sitting on their butt on the couch and they feel awful about it. And the reality is what they're doing is a service for everyone else and themselves. And it's absolutely crucial, but it's so hard for them to understand that. And so that is a crucial thing, to ensure that your athletes understand that it is okay that if they miss a month or two of hard training, and just maintain a low baseline. And on that note of the low baseline, we are working on some basic physiological recommendations from a couple of the lead strength and conditioning and physiologists in Canada to provide to the sports system as a whole, that will just indicate like what levels of detraining are okay over what period of time, and what you can do that is, you know, safe and responsible. And the last thing I'll say is, for all of us that are working in administration in sport, and you know, many of the people on the line here probably have multiple jobs and are volunteers in their clubs and things like that, is the importance of taking care of yourself and pacing this out. Again and again, I don't think we can reiterate enough how much this is going to be a long haul, and uncertainty is going to be the only regular thing we face for a while. And so the message that we're all sharing at the national level is try to pace yourself. Once you get some of these things in play and in place, just try to take it easy. So again, to reiterate really quickly, create virtual communities for your athletes. I'm sure you're already doing this, but do that, connect with them, make them know that it's okay to not train, and it's okay to ask for help, and it's okay to you know, feel unstable by this, and then you know, encourage responsible exercise, I think, is the only way to do it. And by responsible, it really has to be obeying all the recommendations of our public health officials. In the chat box, I've linked to mygameplan.ca, our website, and our COVID-19 resource page. On that page, you'll see there's some things that are national team only, but everything is open and you can click on it. They just link, a couple of them link to national team only things, but in there are just some good mental training reminders for athletes. And we're also working on some lists of books and other resources that you can take advantage of and that athletes can take advantage of. So I'll stop there. Yeah, if anyone has any questions, I think you all know how to get a hold of me, but I'll be on the call for the rest of the night.
Thanks. That's great, Tom. Thanks. And we'll make sure we follow up with on our COVID-19 website. We'll be linking to the My Game Plan resources, and we will be able to share Tom's contact information. Some of you might not know, but Tom is a paddler, along with being a game plan, a pretty good paddler. And so along with being a game plan employee, lead with Canadian Olympic Committee. So for Don's sake, we have had one question, and if other people have a question for Dr. Don, si vous avez une question pour Dr. Don, we will field those now so that we can help Don as he goes and literally is doing critical work in British Columbia to get supplies to the hospitals. So I had one question here, and it's an email question. So Don, as someone who has recently returned from the US, am I allowed to go paddling with my partner who had traveled with me? No one else around that I could infect. If not, why not? I am not hurting anyone.
Okay, so that's a great question. So the question I would have right back is, are you living with your partner? Is that the person that your roommate or maybe you have a relationship with? If you're staying in the same home, in the same place, apartment, whatever, then yes, you can go paddling together. If you're not staying with that person, then that's just another chance where the virus can get communicated across from one person to another. So paddling is fine, and exercise is fine. I mean, I was fortunate. I'm an old guy, but I still put my boat in the Fraser River yesterday and paddled around for an hour. But the difference was I did it not through a club. The boat lives on top of my roof. The paddles lives in my garage. Pogies are my own. I don't see anybody. I don't touch anybody. I just go down and do the exercise for the mental health of it all. So there's nothing wrong with that. There's nothing wrong with going for a run. You want to keep that 2-meter distance from people. It's pretty easy to do, actually, most of the time. But the secret is whether or not the person you're doing it with is a partner that you're living with. So my wife and I go for a walk. That's okay. We live together. She doesn't meet up with her friend from the book club down the street and they go for a walk together, because that's a chance to move virus from our home to their home. And then when their kids go home, it passes on. So pretty straightforward for that point of view. Ian, one thing I should have said, and I would like to say, and that is, we will get past this. This is not the end of the earth or the end of anything, really. I mean, it's a dangerous time to be around. It's a serious problem. But I remember when I was a little kid, the polio epidemic came through. I remember lots of kids my age or a bit older actually ended up with polio, and some of them are still around. Some of them are still battling, actually. We've been through SARS not that long ago. We've been through another thing called MERS. Remember the Zika issue was there for the Rio Olympics. So, these things present themselves, and they have to be dealt with. And, one of the things that we have on our side is a lot more technology than we had even 10 years ago. And one of the things that I follow as much as I can is the fact that there's at least 30 companies throughout the world that are working on a vaccine. And there's a number of different ways to do that. Like the genome for the virus was identified very early on, and there's a company in the United States that's actually using a piece of mRNA to produce a virus, to produce a vaccine to initiate some immunity. The other people are going the old route with taking parts of the live virus and deactivating it and injecting it and looking at response times. But the issue from that is that this is a gold mine. If you're the company that comes up with the vaccine, then there are millions and millions and millions of people who need it and want it. So from that perspective, it's kind of exciting, because this is such a competitive thing that people are not, they're doing all the right science, but they're pulling out all the stops. So, what used to take vaccines 3, 4, 5 years before you could get something, that's not the case now. And we've got some actually crackerjack people in Canada that are getting government funding to take their hats off and their everything off and just get down to work and create this. So, we'll get through this. This will be a bad memory and something we'll all remember for the rest of our lives. But we're a pretty resilient crowd, particularly if you happen to be a paddler, from my perspective. And things will get better. We'll be back to normal at some point in time.
Don, can I follow up? And thanks. Can
Sure.
I'm putting you on the spot, but just to clarify, because the question was about someone coming from the US, so they are in the self-isolation versus social distancing protocol.
Yep.
So can you just outline the difference between those two?
Yeah, if you're social distancing, then you're kind of tagged on to that 2-meter distance, right? But you're still, if you're social distancing, you can still leave home and go do some of the necessities of life. Pick up some groceries, go get some medications, do some exercise, pick up some takeout food from the restaurant, things like that. And then if you're with somebody, if you're social isolation, then you can go out and solo exercise, but you shouldn't be doing off to the grocery store, picking up medication, going to any takeout place. So the difference really comes down to the non-essential activities that you're not, or even the essential activities that you're not allowed to do for that 14-day period.
Okay, so I just wanted to be crystal clear on that because the question was, I recently returned from the USA. So that person in that situation is self-isolating versus social distancing. Yeah, so that, and then there's lots of layers here, so Don will stay with me, but there's the other layers to this are obviously, what are the public health recommendations where you live? So in Nova Scotia, there's different regulations now that have been put out about travel from a certain distance from your home, for example. In Toronto, all city parks are closed, which means a lot of access to lots of things is now closed. So that's another important layer that people need to understand. Another layer is Don lives in the lower mainland of British Columbia for his story about paddling. I have to give full disclosure for you, Don, there. All our policies for cold water paddling, all our policies for safe water are still just as critical and just as important for absolutely everyone to understand and follow. Clubs are shut down, but everyone needs to understand their risk. Like, we're not doing group activity, but people need to understand the risk. So they need to understand those layers. And the final thing that everyone needs to understand is to understand their personal insurance situation. And that's a tough question. And we did have a question I can speak to in more detail later, but a nuance of Canoe Kayak Canada is that our insurance is provincial and our federal body making our recommendations is obviously, our national body is obviously federal. I really encourage everyone to work. We're going to help you work with your provincial bodies, your territorial bodies to understand your insurance situation as well. Like that, we need to err on the side of absolute caution across the country for all aspects of this situation. And we can't reiterate that enough. I don't know, Don, I don't think there's much to add to that, but there just are a number of layers to this. Here's a question for you.
You're right. You're quite right, Ian, and that that's a little bit confusing because you're right. There is the lack of consistency across some of the geographical parts of our country with the relative to what some public health people are doing. And we've got parks closed, school closed, but daycares are open here. So there's some inconsistencies, and we just have to rely on the experience of public health people to understand that they're doing the best they can given the circumstances that they're exposed to.
And I'll just add, we're a structure and a community that works together, and our recommendations are I know there's lots of people on the call who are coaches and athletes or parents or other members of the community, but listen to your coaches, listen to your club boards and your jurisdictional authorities. Listen to them, listen to the public health authorities who they're listening to. Now is the time for us to work together. I have one more question for you, Doc, and then we'll move on. And this, I'll have to limit your answer because it could go. But the question is, Doc, do you think Canada is handling the situation more effectively than China? That's a tough one.
Well, yes. I mean, we're that's a good question. Yeah, we're acting quite a bit differently, if you will, but we're actually taking some of those same policies that China used, and we've tried to implement given the constraints of our social network and the fact that we have some aspects of freedom that don't quite exist in China. So I do think that we've actually done a pretty good job in Canada relative to a lot of other countries. If you follow sort of trajectories and how often, what kind of shape our curve is looking, I think we're actually looking more like South Korea than we are Italy or Spain or any of the countries that are in deep trouble. I quite frankly am happy that the U.S.-Canadian border has closed because I think that what is happening in the United States will be a healthcare story for generations. But so I think we're actually doing a pretty good job. We've taken some of the principles of China. We can't apply them to exactly the same strictness, if you will. But I think actually, at least in BC, with a lot of the people, the public health people and the politicians, being quite emphatic about using these strategies, I think we're actually making quite a bit of headway. So I think that Canada is actually doing a pretty good job, and hopefully we're on the trajectory of South Korea. And if you follow the number of new cases a day, what we're looking for globally and even through the provinces is keeping that stable, and then eventually they will stop, and then like China will have a week or 10 days or 14 days where there's no new cases, and then we can start to ease up on this mitigation and issues that we're dealing and trying to keep people safe.
Okay, thanks, Don. I'm going to have to stop the specific medical questions for now for Don to give everyone their time we need, and there's important things coming up. Our next presenter is Ryan Blair, who's going to talk about coach support and a meeting coming up.
Good.
Hi, everyone. Can you hear me in? Yes. Yeah. I said I'd take about 12 seconds, so I'll try and be quick. Thank you very much, Dr. Don. The National Coaches Association will be meeting on Tuesday or Wednesday next week to go over similar details that are happening within this meeting, but with a really targeted coach approach. So how are we supporting our coaches across the country? We know there's a lot of issues facing wages and employment and mental health. So we're meeting as a group of coaches. Hopefully everyone across the country can join and to discuss what is happening on the coaching front and really just how we can support each other.
Great. Thanks, Ryan. And we'll definitely follow up so everyone has that information, and welcome all the coaches who we know think things are looking difficult for many of us, and especially those who are work professionally in our sport. I'm now gonna pass things for our next section about club economic impact to two of our colleagues here, Kathy Hare and Stephen Indig, and I believe Stephen's gonna lead things off. So I'll pass it to you, Stephen.
Okay, thanks, Ian. You can hear me?
Yes, perfectly.
All right, great. Hi, everybody. Welcome to a crazy time. As Ian said, my name's Steve Indig. I'm a lawyer with the Sport Law and Strategy Group, along with Kathy, who will speak next. We provide services to the amateur sport community for the last 30 years, and we've obviously been quite busy helping organizations manage multiple different fronts with respect to what's happening in today's day and what's changing on a daily basis. I am cognitive of time, and you've given a lawyer a microphone, so I could be here a while, but I will try and go quick and try and speak from a very high level of what we've been dealing with the last, I'll say, 2 weeks. And first and foremost is the actual business operation. And I would ease or ask all of you to first and foremost take a deep breath and let it out and realize that you need to take a minute before you start making decisions with respect to your business operations. There's a lot of people on the call today, and every one of your organizations is likely in a bit of a different scenario. So what I would highly recommend, as a lot of people on the call have been saying tonight, is we really don't know how long this is going to last or how it's going to last and how it's going to impact particularly sport and on the business side, the money flow and the financial aspects of it. So what I would really first and foremost do is challenge you to take the time to look at different scenarios with respect to your business operations and running different models. That if you're closed for 15 days, what does that look like, or 30 days or 60 days, etc. I'd also ask you to start considering as well your values and your ethics, and of course your bank account in that decision-making process with respect to, do you lay off staff? If so, how do you do that? And also I will talk about the employment issues in a few more minutes, but just again, thinking about, we're kind of all in this together, and I hope landlords might be a little lenient on rent, and we as service providers might be a little lenient on how we pay our staff or continue to pay our staff, and how we're going to deal with refunds. Unfortunately, we are in a bit of a hoarding phase, not only with respect to toilet paper, but with money and other things. So people are going to start to be asking those questions about refunds as well. Very quickly, service, we're all in the service business, and you all on the call, particularly on the paddling business. And in order to value that service, of course, we pay for it. So if I haven't received that service, it may be very difficult to keep people's money. Lots of different strategies have been put in place, like we'll defer your session or your fees to another session when things come back to the, the new normal. I know I can tell you my kids' programming, the ones that got canceled in mid-March, do I expect a refund, or I think I'm going to get one? The answer, of course, is likely not. After having received the majority of the services that we paid for. So if you are going to be implementing new refund policies, they are going to be on a go forward basis. Legally, you cannot apply them on a go backwards perspective. But again, I would ask you to consider your ethics as you make these decisions. I also want to remind people that the law does still exist. Yes, there have been amendments to the EI provisions and the sick leave provisions, and probably more employment provisions may change over the next days, if not weeks, but the law still applies. And one of the big ones Ian mentioned was about insurance and the standard of care required of an organization. And the standard is based on, I guess I'll say a couple little things here, is based on what's happening in the industry and also following your gut. And this was probably more apropos a couple weeks ago when some people were closed and others weren't. So why are you open when the trend in the industry is not to be? So I think that has changed a little bit by government mandate. But remember your standard of care in making decisions. And quickly on insurance, Kathy and I have done a handful of these calls, and one of the common questions is insurance. Does it still exist and still apply? And if so, what about home workouts? Most insurance policies applied to sanctioned activities applicable to registered participants. So one PSO decided they were going to sanction home workouts and wrote a letter to their members indicating that, and one decided not to. They didn't want the liability associated with their insurance policy on that particular issue. So again, if you're running, particularly not just providing people links to videos, but if you're running a Zoom exercise class at 7 o'clock on Tuesday night, you may want to ensure it's sanctioned from an insurance perspective. On the employment and contractor side, again, we've been helping organizations through multiple different philosophies on how to manage their staff. I'm going to start with employees. There are 3 different ways, obviously, you can be dealing with employees, in my opinion. One is a modification of their employment agreement, so maybe taking a wage reduction or an hour or a time of service reduction. You're not going to work 40 hours a week, we'll pay you for 20. The second way would be a full-out termination, and the third way, of course, is a temporary layoff, which is the very popular choice of these days. Each one of you will have particular provincial legislation that applies to your decision making. Most of the legislation that I've looked at, particularly with layoffs across the country, is a maximum of 13 consecutive weeks. And after that 13th week, they would be considered to have been terminated. Now, there's also what I like to call employment laws like roulette, or the gray zone. Your employment legislation does allow for temporary layoffs. The common law, which is how courts have interpreted the law, have said layoffs can be construed as termination, as constructive dismissal, as can a modification of the employment agreement. So if you get into constructive dismissal claims, you're looking at providing notice of a payment in lieu of notice, a continuation of benefits, paying out of accrued vacation or lieu time. So you really have to be strategic on which philosophy you want to implement, knowing very well that some people may have the common law on their side to suggest this is an opportunity for me to get out of here and to get a package. So I would suggest anybody who's looking at doing any sort of employment change, layoff, or termination, do speak to legal counsel if you can. I think that would be really important to at least understand your options. I've had that conversation several times the last couple of days, and to be honest, most are going with the layoff. without consent, making it mandation, and if people want to come back and sue them for wrongful termination, they'll cross that bridge. So that's kind of a lot of the lay of the land right now on the employment side. Some of you may have contractors. Yeah, employees are actually governed by a minimum standard by legislation. Contractors are not. The terms of a contract are defined in the contract. So if you're looking at terminating a contractor, first thing you're going to do is look at the contract, see what the termination provisions are. And if there are none, or there's a severe or long notice period, you may want to argue frustration of contract. You cannot provide the services that I've retained you for, therefore the contract is no longer valid. But of course that leads to termination, which may not be something you want at the end. Taking off your legal hat and putting on what I like to call the reality hat, first and foremost, have conversations with people, see where they are, see if people will be understanding in this difficult time. Two more things, and then I'll pass it to you, Kathy. AGMs, a lot of you may have your AGM scheduled in April, May, June, or September, or October. Obviously, that's not practical or possible right now due to lots of the reasons described previous to me speaking. Most legislation in Canada allows for electronic meetings. They also, there's software to support you in online voting. A good one is called Simply Voting. It's very economical. If you have less than 10 voters, it's free. Above that, I think it's $2 a head. So the requirements to hold your AGM are usually 15 months of the last one and 6 months of fiscal year end. So those are usually the dates you're looking at to comply with your AGM. As I said before, most legislations allow for a Zoom meeting to occur online. So again, something to consider too that will not prevent you from having your meeting. Again, you have to be a little cognitive of the number of people that may be on the call and different strategies around that. Lastly, I'll talk about lease payments. Some of you may have rent to pay. I would again defer you to pulling out your lease agreement, looking at the clauses in the contract. I've read several the last couple days. One actually had a clause that said the landlord continues to get pay even if there is an act of God, which is what I will call this right now. And others have said you don't have to pay because of act of God. So two things with respect to your leases, I would say look at them. See if there's a force majeure clause or the default provision or the inability to provide services provision. And of course, I would still always encourage people to use common sense, pick up the phone, have a very heart-to-heart conversation with your landlord and explain the situation. So just very high level, a couple things for people to consider. We've been working pretty diligently with a lot of NSOs and PSOs on templates, on temporary layoffs, as well as terminations. So if anybody needs support, by all means, reach out to us directly if you need to. So I'll stop there, Ian, and Kathy's going to provide you guys some good information on practical resources that's now accessible through the government, unless there's questions.
Well, let's let Kathy go, and then I'll help field some questions, and I have a question. So go ahead, Kathy.
All right. Thanks, Ian. Thanks, Steve. I've seen a couple of the questions come through, and hopefully I'll address it in this section. That's going to be really quick. I think there's potential for us to have a more in-depth session next week with regards to sort of the financial and management part of a club. But what I just wanted to briefly talk about was the temporary wage subsidy that was announced last week by the federal government. And so this is it's available immediately, retroactive to March 18th. For those employers that have paid staff, they can recoup up to 10% of the remuneration paid to a maximum of $13.75 per employee. And essentially this happens by withholding the amount that an employer would pay to the government with regards to the income tax that's withheld. The maximum amount per employer is $25,000. I believe on the CKC website there is a briefing document that I prepared that includes this as an outline. As I mentioned, this is a 3-month period that you can claim this, so it's between March 18th and June 20th, 2020. There's a few formulas that you can look at in order to be able to recoup this. If you're using a third-party payroll provider, such as Ceridian, they're still figuring out how to do this, but it will be applied retroactively, so you might just need to take a little more time on that. If you are doing this in-house, then this is something that you can actually start to apply to your April 15th payroll remittance to the government in relation to your March payrolls. The other piece I wanted to talk about quickly, which was announced, is the emergency response benefit, which was mentioned in one of the comments. So this is something that is, put in place to support workers and to help businesses keep their employees. So this is a taxable benefit that could provide up to $2,000 a month for up to 4 months for workers if they lose their income as a result of COVID-19. So this would cover workers who have lost their jobs, they're sick, they're quarantined, they're taking care of somebody else who is sick, as well as working parents who may be home with their children because they don't have daycare, as well as covering contract workers and self-employed and those who may not qualify for EI, such as those that may not have the minimum number of hours in order to qualify. So this is something that's going to be available on the government portal. They're saying that it's going to be early April. I think it's the 7th of April. Take a look at this. It may be something that you could provide as a benefit to your employees. As people have said on the comments, the focus of the government is that they don't actually want organizations, businesses to be laying off their staff. So if there is a way that they can, the government can support in this way, this is one of the ways that they're looking at doing it. The challenge with the EI system lately has been is that they're overwhelmed. They just cannot process the number of claims that have been coming in over the last little while, and they're trying to mitigate that going forward. Quickly, one of the things, if you are considering laying off staff, it's really important that you complete the record of employment correctly so that it quickly transfers through the automated EI system. And the key thing around this is that when you're completing the record of employment, your COVID-19 related reasons for reason codes should either be A, which is shortage of work, and this would be when your company is temporarily closed down because of COVID-19 or parts of it are shutting down. Code D, which is in relation to illness or injury. So if you have an employee who has COVID-19, or if they've come back from a trip and they're quarantined. Or N, which is a leave of absence, which is when an employee needs to stay home because they don't have daycare or because they have to take care of somebody else. The other important thing to keep in mind is that in box 18, which is usually the other box on the ROE, do not put anything in that box. If you put something in that box, what happens is through an automated ROE, it immediately gets pulled out of the processing system and it gets sent to a caseworker for manual input. And this is the piece that's going to greatly increase the processing time for the employee who is applying for any claims. So as Steve mentioned, things are changing rapidly. We've been updating this on a regular basis. I'm sure there's other things that are going to be coming down the pipe. Provincially, there are economic relief plans in place across the country. So share, Ian shared the briefing document that I provided, and just keep checking online to see what it is that's available in your region or federally as we move forward. So I'll leave it at that, Ian, and I'll pass it back to you.
Okay, so thank you, Kathy and Stephen. We have a bunch of questions, and I'm gonna work on getting through them now. I want to start by saying I'll reiterate, next Wednesday is April 1st, and we are going to have at 8 p.m. we're going to have a webinar that we're putting on with Kathy and Stephen specifically on this topic, so we could dig into questions and issues more in depth. We also are going to work with Stephen and Kathy and their team, and Adam Clevenis, our other counsel who works with Sport Law and Strategy, on a strategy for how we can look at one-on-one support and specific advice for our members. So that we're working on that next week on how we're going to set that up so people can get direct help. We just have to, like everyone, finalize how we're going to support it and what it's going to look like. So we'll answer the questions we can, but I want to make sure people don't leave thinking we will follow up to make sure we can help. And I will say, Phil, I will follow up, Phil Green, with your question shortly. I just want to stick on the financial side. I want to comment on one thing, because on Danita's question or comment, because it is the frame, and I think Kathy addressed this well, but I will just speak for everyone I've spoke to from our membership that our goal is to retain coaches, is to weather this storm as partners between our organizations and our coaches, and how we are going to partner together to make sure that we can get through this and get back on our feet together. And that's the strategies that we're working on with everyone. I'm going to go back. I'm just have to scroll here. So I think we got to this, but the question is just sort of the distinction on independent contractor versus employees. And that's touched by a couple people. Joel asked that question, but also Adam, interrelated, asked the question around legally what's considered an employee, even if you're nominally on a contract. Specifically, Adam points to law in Ontario. So maybe Stephen, could you touch on that?
Yeah. Obviously, there's variance between independent contractor and employees. The major separation is you do not deduct taxes from source. You do not make CPP payments on behalf of contractors, and they have the ability to write off lots of things like their home office and things like that. The CRA doesn't like contractors because they don't get their payments. So in this particular situation, contractors would not be entitled to EI. They would be entitled to the CRB, the new $2,000 a month. I think that's a good point. You want to be careful with your contractors to make sure they're not applying for EI if they are entitled to do so. As they are not entitled to do so, I would also suggest that, per Adam's comments here, yes, CRA does look at different tests to determine if someone's an employee or a contractor. I'm not really sure that they're going to be targeting that right now. I think that's something they would do in a slow day. But there's a 4-part test to determine, and it's a national test, it's not just a provincial test, to determine whether someone is viewed as a contractor or a employee, and it's based on multiple factors. You have to look at it like a pendulum, and the first one is, are they integral to your association? The length of service, do they have multiple clients providing the same service? Do they use their own tools? Do they set their own hours? Do they have a chance of profit or loss? So those are a lot of the different questions that would be asked. It is possible, yes, for sure, that CRA will view people as as employees that may be contractors. And there's actually a new part of law called dependent contractor that gives contractors the same benefits as employees, like notice of termination, if you're viewed as a dependent contractor. The case law related to that is a real estate agent who worked for one broker. Yes, she was independent, did her own business, but she was dependent on the broker to provide her the work. So there's lots of different moving pieces in on employment law. That's why I like to call it roulette. But I wouldn't be so worried right now about whether you're treating your contractors as the right way or your employees the wrong way. I think right now your emphasis is, and I'll reiterate it because I thought I tried to, was to say, as we make decisions about employees and layoffs and things like that, is again, apply your values. If you have a reserve fund, this is the time probably you need it. So if we can keep people employed, I'm obviously a big fan of that, if possible. So that was a long-winded answer, Ian, to probably a relatively simple question.
Right. And I think one other thing I want to just reiterate for sure is that our support for clubs is mirrored with our support that we're trying to set up for our coaches as well to understand this process. So it's we need everyone to understand. And part of that, the questions we are getting are a lot of questions are around Canada's emergency response benefit, which is emerging this week and has been emerging. And Kathy, maybe just a short sort of, again, overview on that. And I honestly think this is moving so fast that by next Wednesday, we will actually know a lot more about the details. But Kathy, can you just speak to that benefit quickly?
Yeah, honestly, it was announced yesterday. So the details on the website are fairly brief and sketchy, other than the fact that it applies to a very broad range of employment definitions, whether you're self-employed, contract worker, whether you are workers who are still employed but not receiving income because of the disruption. All of these different nuances are going to qualify for this CRB. They're announcing that this portal is going to be accessible in early April. I don't know what it's going to look like. I don't know what kind of questions they're going to ask. I don't know how quickly it's going to crash. I mean, one of the main issues with employment insurance right now is that it can't handle the number of applications that are being submitted. And so they are scrambling to try and create another mechanism through which people can apply for some form of financial relief during this time. This was announced yesterday. I'm sure there could be other announcements that happen between now and April 1st. And so we're just trying to stay ahead of the game and give you the information as it comes forward for us. So really, I know as much as what's on the government website right now.
Yeah. So we are, and just so everyone knows, we have beyond that specific question about that benefit, we have been advocating already with Sport Canada, with our funders, and with the Canadian Olympic Committee to make sure everyone is very, very aware and prioritizing the strain putting on our member organizations, our member clubs, and specifically the strain put on our coaches. Know that we are bringing that up at all our meetings. We're bringing it up when we're consulting with the plans, looking ahead to how we will work together as a system. We're in touch with the minister's office specifically on this issue, and we do take it very seriously and want to provide the support we can for those that are really the glue and the lifeblood that keep our sport running in Canada. I had a question about insurance for running online training sessions. That was, I now can't remember who actually spoke to it, but that's a question that needs to go to who you get insured through. It is an important consideration. Stephen, did you speak to that?
Yeah, that was me for sure. So you need to get confirmation from your broker, or if your PSO provides the insurance policy from them. As I said, I've had one client sanction it, saying we'll take the risk, and I've had another one say absolutely not. That was more of a high-end, riskier sport, let's say. So for sure, you want to make sure it's sanctioned. Look, the risk, in my opinion, of in-home workouts is low, but the being brought into a lawsuit is not fun and very expensive. So even if you are right, so I would be clear with your broker, with your PSO, whoever is providing the coverage, as to whether or not they are sanctioning those in-home workouts. And I think, again, I want to distinguish between sending a link saying, hey, go check out Beachbody, versus we're going to run a Zoom session at 5 o'clock and run people through something. So I think there's a bit of a variance there.
Okay, I do have my eye on the time, but I will address a couple questions that are still on the table. Just on this topic, again, we're going to work on how we're going to follow up with coaches and organizations to navigate this time. A big checkpoint will be our webinar next Wednesday, and we also can work with Adam Clevenis, who's a partner in Sport Law and Strategy, who's bilingual, who also can provide advice en français for our clubs that prefer that. So we will keep working with you. And I know I'm repeating myself, but we are with you, all of you, in navigating this time that's so challenging for our organizations. I have one question I have to go back to, and it's from Phil Green. So it's a question about our recommendation for paddling activity. So Phil's question is, the recommendation, if I understand it, is that club paddling is considered an in-person activity and therefore do not do it. But individual paddling outside of a club is okay. And the question was, is that correct? Club activity, including on-water paddling, the recommendation is suspend that activity. Do not have club-based paddling. Do not have any club-based activity. The reasons for that recommendation are that, first and foremost, clubs are a place of congregation where people come together to enjoy the sport, but also where they congregate, and that's a risk. It's also a risk for the organizations at this time, where there's so many recommendations across other sectors of recreation centers and pools, rinks are all shut down, and these activities are shut down across the country. We need to work with that recommendation so that we are shutting down our operations to be in line and do our part. The part to the question, individual paddling outside a club is okay. We have made a recommendation within the structure and the circle where we're able to make a recommendation. Individuals who are members of Canoe Kayak Canada need to understand many things when they make that decision, and they need to understand the recommendations of their jurisdiction about health and safety in terms of public health. They need to understand the implications for water safety and our different codes of safety across our different disciplines. They need to understand, if something goes wrong, what kind of strain will they be putting on their community in a time of crisis. So it's a consideration in terms of if in the unlikely event a rescue is required, what kind of strain would they be putting on that? Those are considerations for individuals to make, but the recommendation is through our member clubs that we do not engage in paddling activity. Ryan just notes that Ontario has sanctioned online training for liability insurance. So I'd suggest, again, because insurance in Canoe Kayak works through our provincial bodies and territorial bodies, that you follow up directly with them to make sure you're covered and you're making those decisions as informed leaders. So that brings us to a late night on the East Coast. So it's 10:37 there and dinner time in Vancouver. So I think I'm just going to let James drop any more from email questions in here. But I think I just want to follow up and talk just now about how we're going to move forward. So our councils, our discipline councils, will continue to meet, as I mentioned, and continue to discuss the implications for our events coming up, implications for our high performance programs as we deal with potential cancellations and adjustments that are certainly very likely with our international programming. We're looking ahead at recommendations that may change over time for paddling activity. And we will keep communicating with you through our COVID-19 website, but also leverage the National Coaches Association, leverage our councils, leverage our subcommittees, and use our structure to continue and communicate and work with you through this very tough time. We're continuing to work hard on this. We're going to follow up from this webinar with an email update with lots of information. So I just want to thank everyone for joining. Thanks everyone for being here tonight. Merci beaucoup à tous et bonne soirée.